recently done, got involved even more with our chapter. He took a position on our board of directors, and he's now chairing our medical scientific advisory council. So we appreciate all the work that you do for us and the information that you brought with us today. In your folders that you received, you should have information about the Lupus Encyclopedia, a comprehensive guide for patients and families. That's a book that Dr. Thomas has coming out in March 2014, so keep your eyes out for that one. But welcome, Dr. Thomas, and thank you.
Thank you very much, Jess. I want to talk about the lupus secrets because I can't keep secrets very well. And the whole reason I came up with this is when I started treating lupus patients, which I can't believe was 20 years ago. What I found out very quickly is that lupus, as all of you know, is an incredibly complex disease with so many possible complications. It's just not about taking your medicines. There's a lot of things that you really have to do on your own to be healthy. And as physicians and nurses in the office, we're only there with you 15 minutes a visit. There's just no way we can teach you everything that you need to know to stay healthy. So I came up with a handout for my patients called the Lupus Secrets. Not because we want to keep them a secret, it's because there's so much that you have to learn in order to stay healthy that they seem like they're a secret because most patients don't know them on their own. And so I just picked out some of the most important ones I wanted to go over. Some of this will be repetitious. Dr. Petrie talked about some of it, Dr. Kaufman in his talk, and Dr. DeMarco as well, but they deserve to be repeated again. Notice at the bottom I have the butterfly. Everybody knows this is the symbol that we use for lupus. But I'll challenge you that I'm going to give you another reason to think the butterfly is the symbol for lupus, not in reference to the lupus butterfly rash, but for another reason, and we'll come to that at the end of my talk. So, secret number one, and all these are written down in the handout, by the way. If you do every single thing in this handout, I guarantee you will do better with your lupus. Number one, you need to add sulfate antibiotics to your allergy list. Unfortunately, a lot of our patients with systemic lupus will flare up by taking a sulfate antibiotic. Urinary tract infections are very common, especially in women, and the first medicine they'll give them is Ceftra or Bactrim. Every year, I have patients, just like Dr. Petrie mentioned her patient this morning, that come in with a severe lupus flare because they went to the emergency room where it's given Bactrim for their UTI. So you need to put them on your allergy list because you're not going to remember when you're sick with an infection, you're not going to remember everything you need to tell the doctor. So please add that to your allergy list, even if you've never taken it, and even if you've never really had an allergic reaction to it. Secret number two, keep a personal record. Don't rely that your doctors want to communicate with each other about your medical condition. I would encourage you all to get copies of your notes, your labs, your biopsies. If you've had a kidney biopsy for your lupus, please get a copy of it and keep it in a permanent record somewhere. How did your rheumatologist diagnose you with lupus in the first place? Get all those labs and keep them in a personal record. A couple of very good reasons for this, that rheumatologists don't trust each other. If I get a patient who says they have lupus and they travel from California, I'm not going to trust their rheumatologist. I'm going to make sure that I convince myself that the patient has lupus, because unfortunately there are a lot of people out there who are misdiagnosed. 20% of the time, your anti-nuclear antibody will become negative on treatment. And so unfortunately what can happen is you can be doing very well and look very healthy. The new rheumatologist checks all your labs. Oh, everything's negative. You don't have lupus. I'm going to stop your medicines. And I had a couple of patients where one patient went to Chicago and she forgot to take her records with her. They didn't think she had lupus or anything was negative. They stopped her medicines. She had a severe flare of polyarthritis and it attacked her lungs. My worst case was a patient of mine who went to George Washington because insurance changed and she didn't have her records with her. They thought she didn't have lupus or anti-nuclear antibody was negative. And unfortunately, she had a severe flare of her lupus and she had a stroke. And so it's a very important thing. Don't rely upon us to communicate with each other. Keep everything yourself at home in a personal, permanent record. See your rheumatologist regularly. Unfortunately, 50 to 60% of lupus patients will develop inflammation of the kidneys or lupus nephritis at some point during their lifetime. And you won't even know it. You don't have any symptoms at all until you actually go into kidney failure. And so we want to see you and do a history and physical pessimistic, but I think that in dealing with a chronic illness, it's really important to know what are the bad things that can happen so you know what to focus on to keep that bad thing from happening. So that's why it's so important for you to focus on the things that can prevent a heart attack and stroke. A study came out just last year that showed that African American women, they get heart attacks and strokes 20 years younger than their peers when they have systemic lupus erythematosus. While most African American women can experience them typically in their 70s, our patients oftentimes start to get them in their 50s very commonly. We've known for a long time as rheumatologists that our patients get heart attacks and strokes at a younger age. We've had study after study after study showing this. Finally, in 2011, the American Heart Association agreed with us. You all know that high blood pressure, diabetes, smoking cigarettes, high cholesterol are considered risk factors for heart disease. Now, systemic lupus erythematosus is regarded as a risk factor for coronary artery disease by the American Heart Association. This is from their paper in 2011. They say women with systemic lupus without clinically relevant coronary artery disease should be considered at risk for heart attacks and strokes and be screened for such. Even more importantly, notice the second part of this. It said that women with heart disease who have had heart attacks should be screened for diseases such as systemic lupus erythematosus and allow the autoimmune disease to be treated. So not only is it a risk factor to have lupus, but if a woman gets a heart attack or stroke at a younger age than what we'd expect, she needs to be screened for the disease systemic lupus. So finally, the American Heart Association is on board. And the reason I bring this up is that quite a few of the secrets I'm going to talk about have to do with preventing those heart attacks and strokes. Number one, most patients should be taking 81 milligrams of aspirin per day. Already, lupus is a risk factor for coronary artery disease, but other things include high blood pressure. 80% of our patients have high blood pressure. High cholesterol, diabetes, if you have a history of strokes and heart attacks in your family. And also, 30% to 50% of our patients are positive for anti-phospholipid antibodies. Like Dr. Michelle Petrie said, these cause increased clotting of the blood and they increase the risk of heart attacks and strokes. So if you have that cardiovertin antibody that's positive, or that lupus anticoagulant that's positive, you should be on an aspirin every day, unless there's a reason not to take it told to you by one of your physicians. Get 8 hours of sleep every night. This is one of the biggest problems I have in trying to teach my patients. Y'all hear on the news all the time that Americans don't get enough sleep, and it's a cause of a lot of problems. Part of our obesity is actually related to not getting enough sleep. An important article just came out in one of the big kidney journals, by the way. It actually showed a correlation between not getting enough sleep and having an increased risk of getting autoimmune diseases. And so I would encourage you to look at your lifestyle. What time are you going to bed at night? What time are you getting up in the morning? And you need to fit in that 8 hours of sleep every night. So even if you have any of these symptoms, feeling down in the dumps, anybody here have problems with memory? Severe fatigue, trouble sleeping at night, loss of interest in enjoyable activities? Anybody here hurt? Ache all over? I'm sure a lot of you can say yes to a lot of those things. 3 disorders are very common in our lupus patients. And for these 3 problems, fibromyalgia, depression, anxiety disorder, prednisone, methotrexate, CellCept, these do nothing for these disorders. And it's one of the hardest things for us to treat in our patients are fibromyalgia, anxiety disorder, and depression. These are neurological problems with the chemicals within the nerves of the body. We have to treat it completely different than we do the lupus. And if you have these problems and your doctor hasn't diagnosed you with any of these, you can actually do some self-tests at home to see if you may have fibromyalgia. And actually put those screening tests in the handout for you. So if you have problems with a lot of pain, fatigue, the symptoms I just mentioned, please take those self-screening tests at home. And if you score high on them, show it to your physician and ask them if you may possibly have one of these disorders as the cause of your symptoms. Does anybody ever have dryness problems? Dry eyes, dry mouth, dry itchy skin in the winter? And unfortunately, about 30% of our patients will have another autoimmune disorder called Sjogren's syndrome. And most people who have Sjogren's syndrome don't know they have it. by the way, Sjogren's syndrome is an autoimmune disease where the immune system attacks the glands of the body. So it attacks the salivary glands. It attacks the glands that secrete our tears and make dry eyes. It attacks the glands of the skin and causes dry, itchy skin, especially in the wintertime, even dry vaginal area. And the problem is that each of these dryness problems can interfere with your quality of life. For example, with a dry mouth, when you don't get enough saliva, bad bacteria and fungus can grow inside the mouth and cause gingivitis, dental cavities, and teeth loss at an earlier age. So this does need to be identified, and we do have therapies to help for all of them. If you have the dryness problems, by the way, go to Sjogren's.org. And it's a wonderful organization, it's the Sjogren's Foundation. They have a lot of good advice on there on how to take care of the dryness. But also make sure to bring it up to your rheumatologist to see if you might have Sjogren's syndrome. You get heartburn problems. Most lupus patients do have problems with acid reflux, and there's a lot of reasons for that. Number one, unfortunately, a lot of our patients are overweight because of all the steroids that we've given them. Being overweight, the extra fat in the stomach pushes on the stomach and makes acid reflux up into the esophagus. A lot of the medicines we use, like the anti-inflammatory medicines and prednisone, they cause reflux to be worse as well. And then some people with lupus will have a problem with the esophagus where it doesn't push food down into the stomach normally. So a lot of you probably are already taking medicines that decrease the acidity of the stomach, such as Prilosec, Nexium, and Pepcid, and medicines like that. But don't rely just on the medicines. Even though those medicines decrease the acidity of the stomach and make it feel better, those contents are still coming up into the esophagus. It actually doesn't stop that from happening. And the problem is that when those contents come up into the esophagus, people can end up having problems where it drips down in the back of their throat when they're asleep at night. It can cause problems with hoarseness, problems with even inflammation and scarring in the lungs even. So it's really important to keep that from happening. In your handout, I put a nice list of do's and don'ts, things that you should do regularly to decrease the amount of reflux that's occurring. Dr. Petrie already said this, keep your blood pressure below 140 over 90. And I know that she's told you 120, but I will tell you that the cardiologist will probably disagree with her on that. Most people know the formal recommendation is keep that top number below 140 at all times, the bottom number below 90. And unfortunately, I do agree with Dr. Petrie that unfortunately most primary care physicians are not aggressive enough in treating blood pressure. I would recommend that you keep a diary of your blood pressure, and if you're seeing those numbers higher than this on a regular basis, ask your primary care doctor to go up on your medicine and get it under better control. If you have certain conditions like protein in the urine from lupus nephritis, if you had a heart attack or a stroke, it's very important to do get that number down more around 120 over 80. And the formal recommendation is less than 1 per week over 80 on a regular basis. So secret number 10, keep your cholesterol normal. Again, you should be getting it checked regularly with your primary care physician because you want to prevent those heart attacks and strokes. Does anybody here have a high HDL level? Especially you women, have you seen your doctor and they did your cholesterol panel? They told you your good cholesterol is really good, or HDL. Anybody been told that before? A lot of hands going up. Well, I hate to tell you this, but lupus throws wrenches into everything. Dr. Deborah Hahn, in 2006, Dr. Hahn is one of the world's experts on lupus. She's in California. She did a study and she found that 45% of lupus patients have an abnormal type of HDL called pro-inflammatory HDL. HDL in regular people actually prevents heart attacks and strokes. It actually decreases inflammation. And so we want it to be really high, and a lot of women have high HDL levels. Unfortunately, in systemic lupus, the inflammation that's going on in their body actually causes them to produce another type of HDL called pro-inflammatory HDL, and she has proven that this HDL actually causes more heart attacks and strokes, and she's had a couple of other papers since this one about the problem. And the problem is that when we measure HDL with a blood test and we do your cholesterol lipid profile, there's no way to separate the good HDL from the bad HDL. So if you get a high HDL reading back, You can't trust that that's all good HDL preventing heart attacks and strokes. I talked to Dr. Hahn earlier this year, and she said right now the test is so difficult to do that they can't get it clinically available yet out in the market. So we're not going to have it available for quite a long time. And so we really don't know the answer for this. But a couple of years ago, she did publish this article where she looked at those patients, her systemic lupus patients, and looked at those that had pro-inflammatory HDL who were getting heart attacks and strokes and such. And she found that the patients who exercised regularly had significantly lower pro-inflammatory HDLs than her other patients. So right now, as a rheumatologist, I cannot tell you if you have good HDL or bad HDL, but I can tell you the best way to prevent the bad pro-inflammatory HDL is to exercise regularly. So another important reason for exercise. So again, having HDL does not equal good cholesterol in lupus patients. So secret number 12, please don't smoke cigarettes. And there's a lot of reasons for doing this. Number one, Dr. Petrie already mentioned that cigarettes actually keeps plaquenil from working. Plaquenil is the safest medicine that we have to control lupus, and people who smoke, they're just combating it by smoking the cigarettes. We don't know why that happens, but it decreases the effectiveness of plaquenil. It also increases lupus disease activity. There's actually a chemical inside the cigarettes called hydrazine. And hydrazine actually increases the immune system to become more active in people with systemic lupus. It also, of course, causes heart attacks and strokes, increases lung cancer. In fact, lung cancer has a higher incidence in lupus patients than in people who don't have lupus, and it's intricately tied in with people who smoke cigarettes especially. Also, cigarette smoke decreases the bone cells from making calcified bone, and our patients who smoke, they get osteoporosis and broken bones more often. But of course, we know as physicians that it's easier said than done as far as stopping smoking. The nicotine is highly addictive. It's one of the most addictive things we have out there. So I did put two sources in the handout. You can call 1-800-QUIT-NOW or go to smokefree.gov to try to get some help in stopping smoking. Exercising is extremely important for many reasons in lupus. This is secret 13. It decreases heart attacks and strokes. As I mentioned in the last slide, it actually decreases that pro-inflammatory HDL. It decreases fat and excess weight. It does improve your sleep at night. It improves your sense of well-being. There's multiple studies that show that people who exercise regularly have less pain overall than people who don't exercise. It decreases stress and it lowers the symptoms of depression and fibromyalgia, which are common in lupus patients. Maintaining proper weight is extremely important, so eating properly and exercising regularly is important for that. Unfortunately, lupus patients are more obese than the general population. And even if you think they're a normal weight, studies show that a lot of patients with lupus who have a normal weight on the scale or on the BMI scale are actually medically obese. And the reason for that is a couple of things. Number one, we use steroids or prednisone often to treat their disease. Prednisone actually causes decreased muscle, and it uses